Welcome, guys. Welcome back to Physio Panda. So today we have a very special guest with us, Dr. Moji Ranganathan sir. He's an associate professor working in SBS University, Department of Physiotherapy. We would like to welcome you here, sir.
Hi.
He's a very senior fellow, and I'm very glad to take his few minutes on a very interesting topic, that is fibromyalgia. So, sir, the question is, what is fibromyalgia?
So fibromyalgia, it is a common muscular problem. Mostly patients have a reduced pain threshold, and depression and insomnia and anxiety. So so many problems are there along with that associated kind of.
So, what are the commonest people who are affected from this?
Mostly in this, females are affected.
Okay, good.
Okay. And according to my experience, I'm telling that mostly the people who are housewives
Okay.
and educated housewives,
Educated.
yeah, that category mostly affected.
So what can be the probable cause of these symptoms in the patient, especially educated housewives?
Maybe because of no work at home, yeah,
Okay.
thinking at any one thing at home.
Okay.
People, they are not caring. If they think people, they are not caring them, and most of the time, they repeatedly, if they are thinking about the same problem,
So it's more like psychological, you can say.
mostly psychological.
Mostly
Yes.
And so if you talk about the diagnostic criteria for a clinician to know that it is fibromyalgia or a pseudo fibromyalgia, I think this is the most misdiagnosed condition in physiotherapy. So can you please?
In USA, they have a certain criteria. We call it as according to American College of Rheumatologists. They say the patient who is having more than 3 months of pain continuously,
Okay.
and if in the body part about 4 or 5 points which may be affected, so that they will put it in that category, fibromyalgia conditions, and mostly depression is predominant in that.
Predominant. So how you can explain the points, because it's a very confusing term, points, because points mean you touch here and it's painful. So how you do define points?
Mostly patients, they won't say I'm having the painful spot here,
Okay.
but commonly they will say that in all the 4 quadrants I'm having pain.
Okay.
It's a generalized painful condition, they will say, and if the patient come to our clinic, we examine that according to the area, and the ACR criteria, they given that particularly 19 painful spots.
Okay.
So from that 19 painful spots, if we found any 3 to 5 points also, we can put it on that
That's
condition.
fibromyalgia. Okay. So it need to be on all the 4 quadrants, or only one quadrant? If you find 5 points, it will call as fibromyalgia.
It differ because if I found only one quadrant, if I have pain,
Mhm.
5 points of pains, then we will put it in that same category. But the thing is, more than 3 months, they should have pain.
Okay. So the chronic, it should be a
Yes.
3-month chronic
Yes.
condition. Like-
And the pain scales, if we are seeing, so it should be more than 4 pain scores. It should come according to the verbal response of the patient.
So is anything to do with the tenderness scale as well in this?
Tenderness scale, no, we won't go according to the tenderness scale in that, but the verbal response of the patient, we will go.
Okay. Any other test we can do, so like to check the painful points in this?
We should exclude other conditions like thyroidism
Okay.
or any other neurological problems. That all the things we can
We
exclude.
can exclude. Okay. So what are the different treatment protocols, I'll say, techniques used in treating the fibromyalgia from a physiotherapeutic perspective?
As such, from the old articles, we got the resistance exercises that are very good.
Okay.
Yeah, and the electrotherapy modalities like ultrasound and IFTs, that is also very good. But recently, what we are thinking is we should treat the physical point as well as the psychological point. So nowadays, cognitive behavioral therapy, they included, and they proved it is very effective. And even pharmacology also, they are included, but pharmacology protocol which will take a very long time, because say for example in pregabalin drug, if we are using, it will go about more than 6 months, and the dosage should be 300 milligrams.
Okay.
Yeah, what we used in the previous researches, it is about 150 milligram only pregabalin, but that is not effective that much because it is an anti-epileptic drug and which settle down the neurotransmitters very slowly. So that's why we should take a more quantity like say so 300 to 600 mg per day. So instead of that, we go with the psychological treatment that will settle down the depression area and the insomnia, what the patient feels, that will also be settled.
So last two questions. Like, first of all, what is the effect of myofascial release, and because this is the most common used technique in this kind of things. And second thing, how a physiotherapist especially can work on a psychological background of a patient.
So psychological background concern, we should know that how to counsel the patient first of all. Most of the clinicians, what we will do, we don't listen the patient at all. Okay, the main thing what I request from my other physios also. So please listen the patient first. After that, while listening itself, they have 50% of the pain which will go. Okay. After that, whatever technique you can apply. So it is not like I am a MFR therapist. So I am mostly telling about MFR which give very good treatment. But in my research also, we are not used the only MFRs.
Okay.
We used integrated techniques.
Integrated.
Yeah,
technique.
integrated means everything we
Everything
put.
should be.
Okay. So and the treatment protocol also, which will take more time. Near about 2 months, 3 months you have to treat. Then only you will expect the recovery and the recurrence you will stop.
Okay. So we can say that if we are working with a multi-directional approach, the prognosis is good in this condition.
Yes.
So here we conclude our session. Thank you very much, sir, for coming. Thank you very much.